Good morning.
Good morning.
All right. My name is Sue Elliott, and I'm with the Arc of Washington State. And today is going to be a little different than what we had planned. Originally, it was going to be our residential providers that are across the state. They were going to have their big rally, and then have the Advocacy Day was going to be all about supported living and the rate increases. Well, they called off their rally and the meeting for today because they thought it was going to snow again. And so they were afraid people couldn't get across to the pass. So we had to decide whether we were going to have this Advocacy Day or cancel it again. But we'd already canceled the other two because of snow. So we thought for those of you that you could make it, we'd just have a different kind of day. And so we welcome you that can come. And what we're going to do is a couple things. Donna Patrick is going to go over some of the bills of interest, and we'll have people from the audience speak about maybe bills that they're interested in. And then we have some note cards for those of you that want to write a message to your legislator about a bill or a budget item that you're interested in. And we can help you out with either the bill number or the district that your legislator's in, so then you can hand carry it over either to your legislator or their staff. So it's going to be a little different today, a little more flexible, and thank you for taking the time to come here. So with that, we're being videoed. We're going to be on YouTube. We're videoing all of us, so we have to like smile and look happy, right? And Donna, do you want to start with the advocacy? And why don't you come over here because...
Well, it's a good thing that the video isn't of the audience because you're so spread out. I'm going to have to go back and forth so I don't leave somebody out. Hi there. Donna Patrick with the Developmental Disabilities Council. So did people pick up the bills of interest in the back? I hope so. It takes a while to go over this. What I want to emphasize is that sometimes people come down to an Advocacy Day and they hear us talk about all the different issues, and it is a little overwhelming, it's true. And then I ask them what they're going to go and talk to a legislator about, and they tell me their story. And that is important to tell your story. But at this point, when session's already going, it really is helpful if you tie your story to what's called a policy objective, which would be like a bill or an issue where something is happening and they can actually take an action on it. I've seen people tell stories and legislators just kind of look at them and nod their head because they don't really know what to do about it, and we need to help them. They hear from people all day long, 3 hearings a day, each hearing having dozens of bills and all the information that goes with each one. Then when they have appointments, they're 10 to 15 minutes each, and so they have to change constantly what they're hearing about. And so you can understand that their heads are just swimming. Plus they have their own priorities. And so it really helps if we can give them something specific that would be helpful that they can do. Besides listen sympathetically, action is always nice. So that's what we want to do today, is figure out what kind of specific action could we take. Because we're well into session, this is a time when we want to ask them to do something and want to show that we have some strength and a need behind that. So the first section is the budget bills, and the governor's budget is out, and the House will be the next one that comes up with a budget sometime later in March, whenever after the March revenue forecast, which means after they learn what amount of money has been coming in from tax revenues. But right now, members, and that's legislators, are being asked to submit their budget priorities to their committees, to their money committees. So that means each House member, each representative gets to either send an email or fill out a form to tell the Appropriations Committee, these are my 3 or 4 priorities that I would like funded in the budget. So right now, what I'm doing is looking for champions for each of the issues. Because if we can say we need something, but if there isn't a legislator saying it and giving that information to be put together by the budget committee, it may not get there. It may not even get into the funding. That's why it's important to be specific about what you want, because they are now submitting their priorities. Yes?
How many requests can a legislator have?
Well, usually 3, but I don't know how they balance whether it's small or large. And our things tend to often be very large. So how they balance that, you may get more. But I've only heard that it's 3 items, not how much it is per item. And so there'll be money that goes along with specific bills, but there's also, like in the case of residential services, you just need money to fund the services. And that is a budget item without necessarily being tied to a policy bill. But we are now approaching a time where they are collating all of the money that would take to implement all of the policy bills, as well as those things that are the straight money asks. So it's very important. Sometimes I use the word champion. Will you champion this issue? Will you champion developmental disabilities? And we do get asked, who is your champion? They need to know if someone is a champion. So like Representative Mari Levitt in the House the other day said, well, she'd like to champion the parent-to-parent program, expanding it to the rest of the rural counties. Well, then I expect that she will put that forward as one of her priorities to do that. We need champions for each thing that we want to happen. It's not enough to have a bill, unless the bill doesn't have any money connected with it. That's great, but usually it's going to take some money for things to happen. So we have a number of bills under residential. We have some adult family home issues. One of those is being heard at 1:30 today in the Senate Health and Long-Term Care Committee, and that's to set up some specialty DD adult family homes. I think there's some would be specialty in Alzheimer's too, or dementia.
I can't find it. What's that bill number? That's Senate Bill 5672. It's on the second page.
Okay, I'm having trouble seeing this.
It's on the second page.
Right. Okay, so the other ones have to do with the access and increasing the number. Supported living request for more money for supported living investigators is moving along, had a public hearing. So at first the policy committee has a public hearing, which you make your case this is a good idea. And then it either goes to rules to be scheduled for floor action, or if it has money involved, it goes to the money committee, and then you plead your case about why it should be funded. Yes. Yeah.
So I see House Bill 1193 and Senate Bill 138 rural community residential rates increase, but it's only for Snohomish County.
Right, this comes back year after year that you have some supported living providers who have people working in Snohomish, and they don't get paid as much as those in King County. They're doing the same thing. Go ahead, Stacy.
The availability is kind of unnecessary because the benchmark rate is not only in. So there's no benchmark rate any longer. The funds are
Right.
So I don't know why it's so.
But Snohomish County providers feel that they're getting roped, and that all people have to do is go across that county line border and get paid more to do the same thing. But that shouldn't be an issue, but the bills are back, so I'm not sure why. There's some bills on background checks. Adult family home specialty is up today. And employment. There's also a bill Friday morning about some of the workshop providers. Workshop providers want to set up day training centers, and that will be heard Friday morning. And they always couch it as a choice. It should be our choice to not try employment and to get, they don't want to call it community access for some reason, but it's, in the aging system, it would be adult daycare, but they want to call it adult training centers, day training centers for adults. And we do have a shortage of things for people to do during the day when they're an adult. This approach has a number of legal issues. The sub-minimum wage, a number of people in the room are...
And Shaun wants to talk about that.
Shaun, where are you? Go ahead.
Why don't you have...
Do you want to yell or do you want to come up here? We have a lot of people that were involved in the sub-minimum wage issue,
I am too.
which was great.
I'm interested in that.
So, right now, as you probably know, in most of the states, if you have a disability, you can be paid below minimum wage. There are people who make 2 cents an hour, and it's just because they have a disability. It is not right. Seattle passed a law last year, so in Seattle, everyone has to make minimum wage, whether or not you have a disability, but that's not the case all across the state. So we have 2 bills. They're the same bill, one in the House and one in the Senate, to change that. And if these bills pass, it will no longer be legal for your boss to pay you less money because you have a disability. So that is House Bill 1706 and Senate Bill 5753, if you're following along your sheet. And the House bill just got out of committee and it's going to rules. And the Senate bill gets voted on today in committee. So they're both moving through the process. So if you visit your legislator today or your legislative staff, just tell them it's very important to you that you get paid the same as somebody without a disability and that you want those bills passed and sub-minimum wage.
And they don't even have to go to the money committee. Yay!
No, they do not.
So that's an easy one, to just say we want to support the bills that outlaw paying the sub-minimum wage. We have an education section next. And Stacy, do you want to speak to any of that? There are bills up today at 3:30 around special education. But there are a number of issues on special education, and I'm getting confused with them. We're depending on Stacy to clarify them all.
Hi, so there's a number of bills about special education. I have to say, in the number of years I've been coming, this is the most special education has been talked about ever. So last year, as you might know, the legislature and the Supreme Court determined that the legislature has met the needs under McCleary, the larger education lawsuit. Unfortunately, it had a little side note, except for special education. And so special education has not been fully addressed. There's a very large gap that everybody agrees exists, to the tune of about $300 million. OSPI is asking the state legislature to fund $300 million worth of special education services. And so far, each of the bills that are here that have any kind of funding implication don't go beyond $50 million. So there's a lot of advocacy that needs to occur so that school districts aren't left sort of holding the bag. Another thing that happened last year is that school districts were limited in what they could charge against their local levy dollars as it relates to basic education services, and that includes special education. And so school districts heavily rely on local levy dollars to fill this gap that we're talking about. They'll no longer be able to do that, and they're not getting the money that they're asking for as well to fund this gap. We don't know if that means school districts will suddenly turn around and say, we can't provide your constitutionally required special education services or not. What we don't want is for the more subtle things to happen where in individual IEP meetings, for example, parents are told, yeah, your student doesn't really need those services, or we can't provide those services until next fall. We know that happens already to some extent, but it's problematic. The other thing that we're watching for in special education bills is elimination of what's called the cap. So school districts can only account for students up to 13.5% of their student population in special education. So for small rural districts that happen to get a foster home or an enrollment number of special education students in a particular year, if they go over 13.5% of their overall population, they don't get reimbursed for those costs and services. And that is a limitation that's put on by the budget committee to say, we need to predict how many students with special education we're going to want to fund for. It's an illegal, unconstitutional cap that everybody acknowledges is something that should go away, but we're not having any luck getting that to go away.
Well, that doesn't seem legal.
It's not.
It doesn't seem legal to me.
It's not legal. Everybody agrees. Even the state superintendent of public instruction agrees.
So, but no one's ever
This is
sued?
an unconstitutional cap. There has not been anybody to sue over it yet.
Wow.
There have been some, yes. So their cap is slightly different in Texas. There was a lawsuit And theirs was slightly different from ours in terms of the implication for funding, but it's still sort of ripe for a conversation. Yes?
So when you say that there's not anyone to sue over, if a bunch of parents are coming together in a specific school district and they're able to prove that the funding has been cut, they're filing IEPs, then do they have someone to sue over? And then they'll put a spotlight on this cat?
Yeah, as long as they can find an attorney who would represent them. It's usually always about the cost of finding an attorney who's capable and able to run this through because it's a constitutional argument and has a good subset of clients and enough evidence to go in and say, we can show you what's happening. Students are not getting services because of the cap. And how can you cap when the law says you must serve all students who are identified within your school district? School districts will say they're serving them, but they're not being funded for those students over 13.5%. So if you think about that, what does that really mean? Where does that leave a school district? Often it means them not providing services or being extremely over. They would normally take money out of their local levy dollars and now they're prohibited from doing that. So what is going to happen is the question.
So would it be better for a school district to sue than individual parents, or would they both come together?
The ideal situation would be if districts and families came together and said to the state, with the state superintendent, say to legislators, no, we can't have a cap. So that's the other thing we're watching for. There's a bill also in here that talks about safety net. So there are 3 ways that school districts get funded for special education. One is just the basic education allotment and what's called a multiplier. So school districts get paid more for every student on an IEP that they identify. And that multiplier number hasn't changed in 25 years, really. Well, it's changed, it's just tiny bit changed 2 years ago. But it's not where it ought to be. It's at 1.02, I think, and it needs to go up to 1.09 to generate enough money to fill in a gap that was identified 3 years ago. Probably needs to go up to somewhere closer to 2. That multiplier is mentioned in a couple of these bills. There's also a safety net fund that school districts can access if they go way over cost. And so that safety net fund has been kind of an emergency pool that districts can say, either I have a high need student, or I'm going to open that cap, but most districts are not getting money for that. Or I had an inordinate situation in my district and I have a need for additional high impact dollars. And the safety net changed its rules because the rules were so onerous for school districts to get access to that safety net fund. Most districts gave up. They didn't even try. Again, led to another overuse of local levy dollars. And so they're changing the rules to make the safety net a little easier to access, but the safety net fund itself has to go up in terms of what's available. So far, every year, OSPI has gone back to the state legislature and said, oh, we went over the cap on the safety net too, can you give us some more dollars? But that doesn't really make sense when we can predict that there are certain amounts that are going to come across. The reason that matters is because school districts have to wait almost a year and a half before they get reimbursement on costs that are up front to them. And as you know, most school districts, especially small rural districts, can't afford that. So we know that that then impacts how many kids are really getting access to services and the extent of services that they're getting. So those are the main issues that we're watching for in these bills.
Question.
Oh, sorry. Yes? What about college? Oh, that's a great question. What about college? Generally speaking, there's no conversation going on about students with disabilities and their access to post-secondary education. The superintendent of public instruction, Chris Rakedahl, he loves this issue. He comes from post-secondary education, and he wants to include people with disabilities, kids with disabilities, including kids with developmental disabilities, in the overall state planning for post-secondary education. But right now, it's not really a conversation that exists. Even in individual transition planning in school districts, generally speaking, the more significant your disability is in terms of communication, social, and behavioral issues, the less likely is that you'll have that conversation at all in your IEP meeting. And part of that is because people don't know what to envision. There aren't very many programs established We have a new program over in Eastern Washington through Wazoo, that's for people with developmental disabilities, and there's a smaller program in Bellevue, but generally speaking, our state has not got a big vision about people with developmental disabilities in particular, or children with disabilities generally, going on to post-secondary education and training, which is a huge gap in how we approach education. It's a good question.
And it looks like the language access bill may have execed out.
So there's another bill that we've taken responsibility for in the disability community, and it's really a larger responsibility for all families and for school districts, and that is language access. That means getting access to an interpreter if your native language is something other than English. And in order to participate in your child's education and to understand what's going on, you need access to an interpreter in your native language. That's a civil right. That's something that all school districts should provide to every parent who requests it or who indicates that they need that. And the school districts don't budget for it. They don't talk about a language line on a regular basis. They don't train their personnel how to use a language line and how to have a meeting with an interpreter because it takes a little more time. There's no training for interpreters on educational jargon in other languages. And for the parent of a child with a disability, that's particularly important because there's so much medical terminology and so many interventions that families need to understand how to engage in and participate in and work with their school. And so not getting access to an interpreter means that you really can't participate in your child's education and you can't tell the school important information. You also don't understand when your child's being disciplined or suspended or expelled or restrained and isolated. So these are big barriers. Representative Orwell has been very good in the last 3 years in a row floating a bill that would expand access for school districts and teach them how to use interpreters and boost what interpreters are trained in, so that it includes kids with disabilities and families who have children with disabilities. And the fiscal note kills it every time. The state legislature still sort of lets districts, we think we provided those services. We can show you when we did it sometimes when families asked, but it's not enough. And so this language access bill is getting a little more traction this time through the Education Committee in the House, not so much in the Senate. And it is an important bill for our diverse families who we really have to support. And so it would be one for you to track and watch as well.
Fiscal note on
There is a fiscal note. It's not as high as it's been. It's mostly around technical assistance. And it's really important because this bill isn't really moving through the Education Policy Committee as heartily as we would like it to. Then when it hits appropriations, if it does, it's important that we say, this is a priority, this is important. Is there another one to highlight?
Oh, is there another?
No, I think
Okay.
that's it.
Great.
Any other questions? All good?
Thank you. You can see the education bills go on and on. There's a couple around school resource officers, and they're being trained. When we were working on trying to get districts to stop using restraints and seclusion and isolation on students, we found out that when the districts hire school resource officers, sometimes they're police who would have been trained as if everyone is very dangerous and treat everyone that way, or they just hire anybody. And so there's no particular training for school resource officers, and yet they have a lot of power, and they're expected to keep the schools safe from our dangerous kids, supposedly. And so I'm kind of thrilled to see a couple bills addressing training for school resource officers. Again, you see how many of these things do have money involved. And the governor's budget has lots of great things in it, but it's predicated upon some tax packages passing. And the legislature hasn't done very much yet in figuring out how they would pay for things. Right now they're talking about what they want to pay for and not as much about how they would pay for it. And they do get down to a point where they have many more things they want to pay for than the money to pay for it. And it gets really tight then, and things start really falling off. Even when they're very important, whenever they're needed, everybody agrees they're good, they start falling off just because there's not enough, they're not high enough priority to enough people. There is money there to an extent, but the demands on it are much higher than what's available. And there are people who would prioritize it differently than other people. It often gets down to what, and that's why you need a champion for each thing that you want funded, because when push comes to shove, they're going to pick what they have decided they will be a champion on, and they have to let some other things drop. Social and emotional learning is moving along in a couple ways. So trauma-informed care and social and emotional learning are some things we've been pushing, particularly in the schools, as ways to treat people, our children, much more humanely. There's some things about diplomas, more about funding. When you talk to a lot of legislators, education often is the biggest issue that they have heard from the voters about. And they've all been out campaigning, they all hold town hall meetings, they all do surveys of the voters in their district, and education is usually what they hear the most about. And education then is many people's highest priority. Now that would be different things in education, but education as an overall topic is usually very high up there. In the Medicaid medical section, there's a hearing today. I think this 1019 is being heard this afternoon. No, it's a Senate version of it that's being heard. In Senate Health and Long-Term Care at 1:30, they're hearing concerning vaccination and antibody titer test notification, and I'm not an expert on that at all. Diana Stanton is. But if somebody's interested in that issue of notifying people and around immunizations, and immunizations is a hot topic right now, of course, because of all the measles outbreaks. So the Senate bill on that is being heard today at 1:30.
It says 3:30 here.
Well, maybe it's in, yeah, it does.
The Senate bill, the Senate version is public hearing at 3:30.
Okay.
Unless they changed the times.
Well, sometimes that happens. I have different things on different lists. We know that a lot of people can't access medical services because of the Medicaid rate, and it does affect our access. So there usually are bills about increasing the Medicaid reimbursement rate, in this case to the Medicare rate. The price tag on that is so high, it's just astronomical, and it never goes anywhere. But if it did, you can imagine how that would help our access all over in all of healthcare tremendously. But it's one of those things, they really pick and choose about these really big ticket items, because they also need to fund some small things for each person. Each legislator needs to have something that they accomplished, that they can run on, that they can tell their constituents that I did. And so even if a number of the big things are really, really important and would help a lot of people and should seem like so obviously right to us, that money's going to get divvied around amongst a lot of people. So the Medicaid rate would have to be a high priority for a great number of legislators for that to be funded. Let's see, surprise billing. Now that should be up today in Ways and Means. The surprise billing is when you go to the hospital for a procedure and you're told that all of this is covered by your insurance, but then you don't know that your anesthesiologist, for instance, was really not in your network, and you get a big bill later because your anesthesiologist, for instance, is billing you when actually you thought everything was covered. And so this is saying that you have to let people know. The insurance companies say, how are we going to know whose insurance covers what for each individual? I mean, you can see where it would become a problem. But on the other hand, people are getting huge bills, and so this addresses that out-of-home network billing issue.
Donna, Cathy's going to
Yes.
talk about the next
Who?
one.
Where are you? Kathy, what's the next one here? Are we up?
Are we on healthcare?
Yeah, okay.
Great. Obviously, we have some expertise in many areas. It's wonderful.
So, bill number 1199 is about health care for workers with disabilities. This is an update of a program that's been around for quite a while. And what it does is it allows people with disabilities to buy into Medicaid, because most of our services are Medicaid services, like your job coach, your supported living services, your health care. Those are all really important services that you wouldn't want to lose. And people often worry about losing those services if they make more money, or if they start getting something called disabled adult child benefits through SSDI, that may impact the amount that they can work. So what this bill would do is take away the cap, and that individuals would be able to make more without having to worry about losing their benefits, which we think is a really good thing. And it is having a hearing tomorrow at 1:30 in the Senate, or in the House. And there's a Senate bill, but the Senate bill's isn't going to do anything, which is fine because they know it's coming, and they're starting to look at that. They'll just look at the House bill when it comes over. So we're kind of excited about it. So yeah. When will we know? Once they decide if they're going to vote on it. So it's got to go. It's tomorrow. The hearing is in the budget committee, the money committee, and they'll decide there. Then it'll go into rules, and then the whole House has to vote, and then it goes through the same process on the Senate side. So this is Representative Eileen Cody's bill, and she's very excited about it. So if you have a chance, you might want to thank her for it. So thank you.
And it did pass out of the,
Why is there a fiscal note? Why is it going to the budget committee?
There is some because people will pay. It's not a huge fiscal note, but there is some because people would have services. So in other words, instead of dropping off services when they make more money, they would continue to use Medicaid. So if they're using something like personal care,
they'd be able to continue that.
they would be able to keep that. So that's where that comes from.
Kathy, there's one more question back here. Let's see.
Take the mic, Kathy.
For what?
For SCI, because even the title has to do with working individuals.
Yeah, it's only for people that you have to work at least 1 hour a month to be in that program. So it's Medicaid buy-in. Does that help?
So it isn't specific to SCI.
SSDI, SSI, SSDI. Yeah, that if you have a disability.
With a non-working.
No, it doesn't. It's not for folks that are non-working. Yeah.
But we want to keep those who are working.
Right.
Working and getting benefits. Thank you. Let's see. Traumatic brain injury. We have a bill in the House and a bill in the Senate about doing some early screening with foster care children. And the screening is for traumatic brain injury, but it's also will pick up some mental health and developmental disabilities issues. So that's really exciting. And when in the hearing, I thought it sounded like the screening was fairly simple and it could be done easily enough. So anything that we can catch early and get into any kind of appropriate intervention or treatment is fantastic. And I think there's also one about expanding the TBI fund a little further too.
Donna, I want to talk about one that you missed.
Well, I was going to come back to it.
Okay. There's a bill by Senator Braun, and it's right here. It's 5483, unnecessary hospital use. And what he wants the State and Developmental Disabilities Administration to do is start tracking individuals who have a cognitive disability, but also might need behavioral health or mental health support, and that are ending up in emergency rooms in the hospitals. And then he wants to have the State Developmental Disabilities Administration provide them some supports while they're in the hospital. And then if they don't provide support for the person to move out of the emergency room, they want the state DD administration to pay the same cost per day as it does for somebody in the institution. And the state ARC is supporting it. However, we know the state DSHS and DDA will not support it because they don't have the money to do all of that. What we've found over the years, and there's a couple bills that we're following to address this, is that our state, even though we're really wealthy, I think Shaun was saying that yesterday, it said in the paper that we're one of the wealthiest states in the country. Well, even though we might be really wealthy as a state, we don't really fund the supports and services people with developmental disabilities need. And so what's happening is that families who are in crisis with their sons and daughters living at home with them, and either their child or the adult that lives with them is having incredible behavior challenges, they don't know what to do because the state DD system, they're pretty full of the state institutions. The community residential providers aren't able to support all those people because they can't attract enough staff to support people and hire them. I think they said there's a 50% turnover in their worker rate. And so people unfortunately are ending up inappropriately in emergency rooms. And so legislators are trying to address it. The issue that I find though is they always want to address it with no money. And you can't do that. The DD system, I find, is facing incredible challenges, and people with disabilities are facing incredible challenges. We don't have enough workers in the workforce, or that are even interested in the workforce or in working, and we don't have housing. I mean, there's just like everywhere you turn, there's an issue, a big issue against special education everywhere. So my request of you all is to make sure that you also let legislators know that we need additional funding in the area that you think that your family or you need help in, because without the money, it's nothing. It means nothing. And so anyway, that's what Senator Braun's bill is. And you have a question? I can't.
Can you come up
Western State
closer?
Hospital cutting back on staff.
Is what?
Western State Hospital cutting back on staff.
Oh, Western State Hospital is? I didn't know that.
Question.
That's a question.
Don't know.
No, I don't think that they are. Or what, do you know?
What it is you don't pay them enough, so there's hardly any staff, and so does that they can get, plus they get injured by patients sometimes. So they're trying to do better at get Western State Hospital back at lost its federal funding because
Right.
It's the
Well,
same
yeah, they
issue
weren't
though
being
everywhere,
understood.
is that we're not paying the people, enough people to do the job.
Right,
We have that everywhere.
right. Stacy?
So does Senator Braun's bill have an adequate fiscal limit on
We haven't seen the fiscal note, but I'm sure, when state government doesn't want to have something passed, they say it's indeterminate. So whenever you see that word indeterminate, it means the state government doesn't want to even put a fiscal note on it because it's so big. So I haven't seen one, but I'm sure it'll be an indeterminate amount.
And the amendment that was put on it, maybe yesterday, said that if DD can't provide the help to people in the hospitals and give them the services in the community, then they need to put them in the RHCs. Basically get them out of the hospitals. And this was a hospital amendment. Didn't care where, just get them out of the hospitals. Well, you can't put them in the RHCs either without adding some money there for people. Wherever you want to serve people, you're going to have to pay somebody to do it. And they just keep looking for ways to blame somebody else and not pay for the services, the people it takes to do the job. Yeah.
And then aren't there two items in the governor's budget for crisis respite and crisis care that would be helpful?
There are enhanced respite beds, and there are crisis solas, state-operated living arrangements for children.
And then the group training homes.
And group training homes are something for the adults coming out of Western State and the institutions. So the governor's budget does have some good things in it that, if they were funded, would start addressing this. The question is whether the legislature will fund them. They come to quite a bit of money.
But again, you're going to have people who are trained in DD and mental health. You're going to have places to provide the services. You just cannot provide the services without paying people to do it.
So the theme I think you're hearing from Donna and me is that it's all about the money. Because a policy bill that doesn't have money in it just flies through, but there's not many of those. And before the legislature even started, they were saying there isn't enough money to fund what's in the governor's budget request. And so what the governor did, instead of submitting the request that he's supposed to, there's a constitutional statement that says the governor has to submit a balanced budget by December of each year. And he submitted that, but he didn't show it to anybody because he said the cuts would be so bad. So we already know heading into the budget negotiations that they don't have enough money to practically support all the caseload growth that's being demanded. So everything that we're wanting is on top of that. And that's why you need to be very specific and about what it is you want funded this coming legislative session. And we got to get David Lord in here because he's our expert on guardianship.
Yes, he just pulled somebody out. At the top of page 5, there's one that you might be interested in. There's a House and Senate bill called Personal Care Pilot. And when we had a work session on homeless and DD, it was clear that even if you can get a person with developmental disabilities can get a spot in a homeless center, that doesn't mean they can bring someone with them to assist them because it still is only one spot, not both. So this is a pilot to provide personal care to people with disabilities in a homeless shelter and while they're getting eligible for service. So it's a great idea. I expect it would have had a huge amount of money attached to it. You often start out with a pilot to try to show that something can be successful, to make the case for it. And the fact that we were even asked to speak on DD and homelessness was the first time ever, I think, that that's happened. And so getting some attention on that was fantastic. And King County ARC had a lot of good information. So we had 2 new bills at the top of this page that we just dropped, one on respite and the other one on community guides and community engagement coordinators. Respite providers have missed out on a raise, and if we want to build our community services, we're going to need to pay people to provide respite and provide community guide and community engagement services. Again, we just can't have a service if we don't have people paid well enough to provide it. Does somebody want to ask David to come back in here to talk about, we depend on David to talk about our...
And while you do that, I'll talk some more.
Oh, we can talk about wrongful death.
So on the 2 bills, that one about respite and one about community guides and engagement, what last session, the legislature provided a 2% increase for all the services in state government practically, but they did not include an increase for community respite providers. Now, in my mind, that's probably the one thing that individuals and families need in the community is to find respite providers. And so what this bill does, it provides a 2% increase over the next, I think, 3 biennium, so that families and individuals can find providers to help support them at home. And I talked with somebody from the state DD office yesterday. They didn't think that the fiscal note would be that much, which would be great. So, well, I haven't seen the fiscal note yet, but I think that if it's not a lot of money, we could maybe ask for it and really support that bill. And then the community engagement and community guides, those are services that the state DD office contracts for individuals to help people, adults with developmental disabilities, provide meaningful things to do during the day, so that if they have a job and they don't have many hours with that job, they can also then get community engagement, or if they don't want a job, they can use the community inclusion. And who's David?
He's on the phone.
He's on the phone. All right.
So let me talk about informed consent under this protection section. This bill is moving along, as Representative Kilduff's, and there are times when someone with the developmental disabilities isn't able to get a needed medical procedure, like a surgery, because they don't know who is the guardian or who can give the legal permission. for that to happen. And so this bill expands the people who could be giving that kind of permission. They would need to pass a test about being an active part of a person's life. Not just anybody, of course, but it does make it more likely that someone would be able to get a needed surgery at the time that they need it. So David, if you would come up here. David's our lead on all these guardianship issues. Yeah. And OPG caseload and definition of abuse, all these kinds of things. And the camera's right here.
Oh, the camera's there? Okay.
Speaking to
Okay.
speaking to the camera, yes.
Okay. So there are several guardianship bills that are moving, and one of them is the Uniform Guardianship Act, and there's both a Senate and House version of that. And let's see, what's the bill number? I'm sorry, I don't have my bill numbers in front of me. I should have had that.
Well, it's easier for them to just see the words, I think, than the numbers.
Okay. Well, it's the Uniform Guardianship Act. And that's I am encouraging people to support it. And if you talk to somebody about it, just encourage them to make sure that all of the protections that are in our current law stay in that Uniform Act. What's happening here is that in the Guardianship Act is that Senator Peterson wants to have our act kind of cleaned up because it's been many years and it's kind of messed up. It's disorganized, I guess. So this will organize the act. And it will also, and so it doesn't, in that sense, it'll also change some of the wording, so we'll lose the wording incapacitated person, that won't ever be there again. Instead, I think they're going to use a word like respondent, something that's much more neutral, and that's an improvement. And so there's several other changes that are made to it, and the thing that I'm probably paying the most attention to is what I was just saying, is making sure that we keep any protections that are in our current law in that new law. So that's a good thing, I think. So I'm advocating supporting that with that, making sure that all those things are in there. So I've got a question here.
Just quickly, David, on the thing you're just talking about, if it's just a policy deal, just with no money attached to it?
Yes, the question is this just a policy thing? And that's a great question. Senator Peterson would like it to be just a policy thing, but there's a big fiscal note on it. And the fiscal note is because the court system thinks it'll cost some money to change over to this new Guardianship Act. In particular, they have some money in there for more training. Now, I think that's a good thing. If you're going to change the law significantly, you should probably make sure the courts and the lawyers and the people that are most affected understand what the law is, how it's changed. So there is some money that will be attached to this to implement it, but it's primarily a policy thing.
So we just emphasize that it's going to take some startup money just to get it going, but otherwise it's just a policy just to make sure to get through the system really fast.
And I would advocate supporting that there be some money for the training, because we want that training, and you probably want that training to be available to advocates and not just to court personnel, I imagine. So that's one thing. Another thing that's really related to this is guardianship monitoring. There's a bill that would create that. I would set it up so that, I know some of you may be aware in Spokane, they monitor guardianships closely. They have a program to do that. And in the process of doing that, they also provide some training to people, and they train the new guardians about alternatives to guardianship, and they make sure that they really want to be guardians and that they understand what's involved in being a guardian. So that's something that they're doing in Spokane, and so they will provide some more money for that monitoring thing, and then they'll also have two other counties where they'll have guardianship monitoring, and those haven't been selected, but those would be selected. That would be some money for that, to set up that program, and then it would also be a policy change, because the monitoring is supposed to be done to a certain amount of rigor. That is, there would actually be people visiting to make sure the guardian was doing what they were supposed to do. There would actually be accounting, they'd actually look at all the reports to make sure no money got stolen, that kind of thing. So I think it's a really good bill. So that's the guardianship monitoring. And then
Wrongful death.
Wrongful death. And then also there are a couple of bills that will fix the Office of Public Guardianship so that it works better, and so that they do alternatives to guardianship, and those are both good. And then wrongful death, I'll just say to wrap up on this, is is moving right along. And what the thing on wrongful death is that, as many of you may know, in our state, in order to recover if somebody is killed through the negligence of someone else, there has to be a financial, somebody has to be financially dependent upon you. So if you're for a person, for example, a person with a disability, if they're not working and they don't have somebody financially dependent upon them and they're killed through negligence, there's no recovery for any of the family members, and that's wrong. And so this bill will change that. So that's a bill that I think has a lot of support, and I think is actually going to go through this year. So,
David and some of us have been working on this bill for over at least 20 years.
yeah, I think some of you out there aren't as old as this effort is to try to get that bill passed. It's as long as I can remember. I see Mark Stroh out there, and I know he was working on it before I even worked at the Protection Advocacy, so it's been around a long time. Are there other questions or things I can tell you about guardianship? There are a couple of them. Okay, this one.
So David, can you clarify supported decision making? My assumption is that the individual would then have input into whether or not he or she would like to have a guardian. Is that?
Yes, and well, actually, so the way there's a thing called supported. The question was about supported decision making, and so I'll briefly explain that supported decision making. The idea behind that is that rather than having somebody take your rights away in a guardianship, you have people who support you in making your own decisions, and you identify those people and give them some authority, and they assist you in getting what you want to have happen. They could also make a decision, I think it would be good for us to have a guardianship and we want to do it, that's a possibility. But there's all kinds of different ways. People basically they can do things, they can structure that the way that they want to. And I would say that the Uniform Guardianship Act also recognizes supported decision making, and actually I would bring it into our law as a recognized thing. I think there's still some work that needs to be done on this concept. I mean, there's all kinds of possibilities. It can be a really great thing, or it can be something that ends up badly. So, but supported decision making is a concept that is going to, I think we're going to hear more and more about, because it's going to be in the Uniform Act. It's also something that in the future, the Office of Public Guardianship will be able to do instead of guardianship. So they can support somebody in that way if they like, if the bill passes. So that's another good thing. And back there's a question or comment.
On the monitoring, is that right now in the bill going to be like a pilot, or is this something that's actually in the bill that will have regulations?
I missed the first part. Is what going to be a pilot?
Is the monitoring aspect of the guardianship, is that something that's in the bill, or is it a pilot study type?
I just missed the key word of what you were asking.
Guardianship going to be a pilot.
Which one?
Is it a pilot?
Is what a pilot? The monitoring. Okay, yes, the monitoring. Is the monitoring of the pilot was the question. And the answer is yes, it's a pilot. It will be funded, and there will be 2 of them around the state, and additional money also to Spokane County so that they can shore up their model. But that's still a pilot at this point. The idea being that we would eventually go statewide if it works out, but they're going to be taking data about how it works. Is there a follow-up there? Yes.
Has there been interfacing with DDA since they can wake up every 6 months visits for family, people that are with their family, because that seems like that would be.
There hasn't been any conversations about Developmental Disabilities Administration. That was the question in relation to that. How about if you and I talk about this afterwards too, so I can give you more detail of what I know? Because I think I've been too long, probably. Is that it? Mm-hmm. Okay, thanks.
Well, we'll talk about the True Blood.
Okay. Okay, great. Good. I'm getting all kinds of time. That's great. And the True Blood. Okay, so what's happening right now is there is there's a problem with so many people with disabilities end up in jail instead of getting treatment or support or services that they need in the community to make it, and they end up in jail because something goes wrong, and the cops pick them up and take them to jail because that's the only place they have to take them. They should be diverted. individuals like these are people with, sometimes with mental illness, sometimes with traumatic brain injuries, and sometimes actually with developmental disabilities, or autism, or all kinds of disabilities. Anyway, they end up in the criminal justice system. That's wrong. They shouldn't be there. And the True Blood lawsuit is a lawsuit that we brought, Display Rights Washington, and we settled it with the state. And the settlement is now being implemented in the legislature. And it's being implemented through two things. One, a bill, and that bill would change the law to, and I'll tell you in a minute what it does. And the second thing is a whole bunch of money will come to provide for diversion so that people don't end up in jail. So that instead of going to jail, the police officer, when they find somebody who's got some kind of an issue and they can tell that it's a person who's got some kind of disability, they can take them to a crisis response center instead of taking them to jail. Or they can, there's a variety of different things that are in the bill in terms of funding, including even some transitional housing. So a lot of different things that are available. So that's the money. But what the bill does, it creates a person who's in the jail called a forensic navigator, who'd be there in the jail to assist the person in getting connected with services and getting out of jail. So for the people that end up in jail, who get picked up, where they've got a mental illness or other disability, the forensic navigator would assist them in making those connections. And I know for any of us who've worked with people who are in jail or have family members who have been in jail, it's a really difficult process where you're really isolated. And this forensic navigator would be somebody who can assist the person in making sure that when they got out of there, they had somewhere to go and they had the services they need to be able to make it. So that's a key thing. And there are some other things the bill does, but that's probably the most important. Other things on that. There's a lot going on in the mental health system. I would say a whole bunch of money this year for things like to fund the things in the True Blood lawsuit, those things that will help support people, more services in the community. But there's also, you may have heard that the state hospitals are having trouble, and they've been particularly Western State Hospital has had problems in terms of their federal funding, and so there's a lot of money, a lot of effort that's going to go into some reforms in our mental health system as well. Okay.
Thank you. You want us to talk about the DD rights bill? When are you going to come up?
Thank you.
You can see we're following a lot of bills.
It's a very busy day. Hi everyone, my name is Beth. I work at the Office of the Developmental Disability Ombuds. I'm to talk a little bit about the Rights of People Who Use DDA Services bill. It's House Bill 1651. It passed out of its policy committee last week, which is very exciting. We're very excited about it. The bill does a couple things. So currently, right now, people with developmental disabilities have rights, but they're written in all different places, some different rules and different statutes. There's not one place to go to look and find those rights. So this bill puts them all in one place, so it's easy to find. So if you are looking to see where your rights are, you're trying to help someone figure out what their rights are, you can look in one place and get those rights. It also requires DDA to give you a copy of those rights every year at the annual assessment. So it's trying to make those rights more accessible for people. Something beeping. The other thing it does is it makes sure that if you're receiving residential services from DDA or a provider, that your rights are the same in every service setting. So when you change providers, that your rights don't change, because that's really confusing for people. So for instance, when services are terminated, you get 30 days notice if you're living in a facility, and this bill would require 30 days notice in all residential types. So if you're in supported living, you would get 30 days notice as well. So it helps you have time to find a new provider, it's less confusing, and it would help you find new housing if you had to do that as well. The other thing it does is it gives people a right to be present and participate in their service planning process, and also to have a copy of their plan. So folks often have many plans, some from DDA, some from their providers. And what we've learned out working with people is that they often don't have a copy of those plans, which makes it really hard to tell what services you're supposed to be receiving and what the plans you agreed to are. And so this bill would give people a right to their plan.
Does the bill have a fiscal note?
The fiscal note has been requested, and we don't know what it is yet, and we are eagerly waiting to see
I'm
what it
trying to
is.
figure out why would it have a fiscal note?
So the bill, it puts the rights together, but also creates some new rights. So the right to have notice of enforcement action is something it creates. So if enforcement action is taken against your provider, you would have a right to have notice of that. And so that they're saying that might generate a fiscal note. It's case manager time is what they're saying, but we're looking to see what it will be. So thank you for the question. So we're very excited about this bill. It is in the Money Committee now, and we're waiting to see what the fiscal note is. And so we're encouraging people to support it. So if you are supportive of this bill, please tell your legislator that you are supportive of the bill so we can get it out of the Money Committee and keep it moving.
House, Senate, or
It's in the House. So it's House Bill 1651.
Why is there a bill in regards to that?
Why is there a bill?
I'm trying to understand why is there a bill for that?
So the reason that we put together this bill is because people's rights are in a lot of different places right now. And so when we were out talking to people, we learned that it was hard for people to know what their rights are so they could advocate for themselves. So this bill puts them all in one place. Yeah, and then it creates some of those new rights we talked about that people are asking for. Yes?
Can you stand up and speak up? We had trouble hearing you before.
What is that one place you're speaking of?
The one, so it would be a new chapter or a new piece of RCW 71A, so the developmental disabilities section of the state law.
Does it have any possibilities that that one place would be also carried by the case manager? Because that seems like that's kind of where the training rights get kind of do this, because if that one person tells one person, well, yeah, you can have community value and work, and then another case manager or whatever is saying, you only have, non-working and community like that. And so, does it have any impact on the actual upfront people that meet with
The case managers? Yeah, so it would require the case managers to give you a copy of those rights every year, so everyone would know where to find them. So it's trying to create some consistency so things are less confusing, so people have the same information. So it would require everyone to get a copy every year, and for case managers to know about those rights and hand them to you every year.
Anytime there's a change, there's a training issue for people
Yeah.
like case managers.
Yeah, so hopefully. Yes, David?
There's a briefing at the Regina.
Yeah, so there's a briefing at the DD Ombuds office, which is just down the street. We can give you the address if you'd like to come, where we're going to talk more about this issue and some other bills that are up this year. And we really would encourage everyone to come. We're having pizza. So come for lunch and we can talk more about this bill and ways that we can support you and you can support us in doing this work. Is that new? Thank you, just down the street. Yeah, thank you.
Serving food is a great idea. First question I asked. Okay, I think we're on the last page. The plastic straws bill was a big controversial issue for a while, banning all plastic straws. And we had a lot of people who said that that wasn't going to work for them. So now the bill is just restaurants and food establishments aren't going to hand out, if it passes, wouldn't be handing out plastic straws automatically, but they would have them so you can ask for it. And then there, the traumatic brain injuries again.
Donna, you got two things here. One is the ban on traffic,
Yeah, there's
and then the other one
is plastics, and that,
plastic stuff.
yeah, that's the, like what's happening in this county where you can't, the grocery stores can't give out plastic bags. And that would make this statewide eventually, reduce the use of plastic bags. We haven't been involved in that. It didn't affect us, you know, as directly as the straw bill did. An interesting one down here is 5487, personal caregiver access. We don't know if it'll go anywhere, but it says that when you're the caregiver and you're accompanying someone to into the movies or some kind of entertainment place where there's an entrance fee, that the caregiver, the personal caregiver, would get in free because
they're only there to support the other person. And so there were questions about how that could be abused. And so we don't know if it'll go anywhere or not. There are some, like Disneyland, I guess, lets the caregiver go in free. And there are some companies, big companies that do, but it's not like the law for everyone. And so there was business concern about that.
Yeah.
You like it, I bet. I wanted to mention, I lost it. 1851. Things are happening so fast they don't always get on here. We can't keep up with them. But a new bill came out yesterday by Representative Sen from Bellevue, or maybe it's Mercer Island area, and it would have set up some. I think she used the broad term care worker. It would set up a center where they do research and figure out all the different care worker types of jobs and what would be needed and how people could help each other and what would be best practices. And it's really a good idea because, as we've said, we need to have a workforce. We need people who are willing to do our jobs and who are paid to do them. And so this would try to bring together all that information about all these different caregiver types of professions and then figure out what would be needed and how you could move from one to another and how you could maybe have a career ladder. I mean, we lose people. We have huge turnover and we lose people. So someone paying attention to the whole caregiver field is really exciting and really cool. Yes?
So haven't we passed the cutoff date for policies yet, or is that coming up?
It's coming up.
Yeah, it's
We
coming
haven't
up.
passed it.
Yeah.
Anything policy-wise, I heard was Friday.
Yeah,
I
and
think
then,
Friday.
and then I think the money committees is like the following Monday, really tight, yes. 1851, so that's a great one. So we've talked about so many issues though that it's really probably kind of confusing. What I wanted to do is see if there's anything that people want to talk about individually or where we can help you with what you actually might say to a legislator or staff person about a particular issue. You don't have to have a great deal of information about an issue. You can say what you feel, what you want, but it would help if you were specific, and we'd like to help you with that. But you don't have to have all the information. If they want more information than you have, then you send it back to the council or the ARC, and we'll do the follow-up. Yes?
Okay, perhaps you can advise me here. I see here, you know, increasing the benchmark rate for the AIDS in Snohomish County. While I'm in King County, like someone else said, I understand that the benchmark rate no longer applies to DSPs. But obviously, for reasons other than my self-interest, I would like DSPs and other care workers to, you know, that the budget be increased. How would I approach that with my legislator?
Where are you from?
I'm from Seattle. He's from Greenwood. I'm in the 36th district.
You can say that you want to support the bills. You can tell them, and you can tell them why. But I don't think those particular bills are going to go anywhere. I think they're trying to deal with those issues like across the board, and instead of county by county.
But no, there's also a governor's ask for supported living generally.
Yeah, but really, you address that by supporting the governor's budget for the rate increase for all of supported living.
Okay.
It's really better when you can deal with something on a big statewide level.
Yeah, because I knew that this particular one wasn't relevant to me, but I was just wondering.
There was a fairness issue there, certainly.
Yeah.
But if we were to increase it all uniformly, we would address that.
That's the way I'll approach it. Thanks.
Somebody else have any specific issue? Yes.
This is, I have a question about Senate Bill 5482, the ECT therapy. Now, it says it's under review, but I just have, there's lots of red flags about that, and I don't know where that is, or it's early in the process, but it basically says that
Okay, so we have a couple people who can speak to it, who've done more research. You want to go ahead, Mark? Weren't you raising your hand?
Yeah, have him come up though, so he can be on
Yes.
here.
You raised your hand. There is research being done on this.
I believe the bill was pulled the day that it was scheduled for a hearing. And we do think it's not going to make it. But if it did, that there's a legal challenge to it. It's unconstitutional. It's a bad bill. I encourage you to communicate, but I think they've figured that out. We were ready on that day. David Lord was ready on that day with testimony. We would be glad to share the testimony. We've consulted with the Bazelon Center on the East Coast, which deals with mental health issues, and they provided us a lot of good information on it. Bad bill, but I hope it's dead.
That's what I have heard too, that it's, what alarmed me was there were a couple of good people's names on it, and I think they were probably told that, oh, would only be used in the most extreme cases in mental health. And I said, but this says that you wouldn't, this takes away choice. And, yeah, we'll watch for it, but we think it caused an immediate reaction, and I think they just pulled back. Yeah, if anything happens, definitely. There was someone behind you. Yes.
I was going to say, I am actually a person with mental substance disorder, and they don't use that very much, but it's a you have things to do, so things that they give us some value or something that, well, I'm against this for sure.
Something not so extreme?
Yeah. There's so many drugs now that they can help us.
Yeah. Did you have a question? Okay. Yes. You want to go through?
Yeah, thank you, Donna. We have little white sheets, if you didn't pick them up, they're in the back, and it has, you can put your name on it and the legislative district, and what issue you would like to let your legislature know that you want to have them either vote on or not vote on, or a money request that would assist you in somehow, like you might want to support, say you want to support the governor's budget for supported living providers, if that's what you want. There's a list of the budget items in the governor's budget request also back there, and you can look to see if there's any items that would impact you. I've been in this field for a very, very long time, and I've been noticing our state more recently and all the challenges it faces. We've been told by the Department of Commerce there's 80,000 people a year moving to Washington State. 80,000 a year. That's been going on for the last 3 years. They think it's going to decline somewhat, but it's still going, we're still having growth. And I was told yesterday by the State Developmental Disabilities Office that last month they determined 1,000 new people eligible for services. So that's on top of the 46,000 people in services and the 15,000 people that don't have any services. And so I try to think, well, what is it we can do to get the legislature's attention? It's wonderful that mental health is going to get a lot of resources. I've been here 30 years, 3 times they've reformed mental health. The Children's Administration, they now have their own department, and they've been reformed. The only system that's never been reformed is developmental disabilities. And we all need to think about, what do we need to do differently to get the legislators' attention that we are, and you all, are important enough to have enough resources to be supported. So if you have ideas, now or this summer or whatever, we've got to do something differently, because we make a little gain, but we don't make the gains that I see in other states. I've been looking at what other states have on their waivers and stuff. A lot of them are so robust, and there's no reason that we can't be. It's just getting the legislature's attention to know that you are as important as anyone else. You're as important as education, or you're as important as mental health, or any other thing. And I think sometimes we're not sure enough that we can make a difference, but you do. If you write these little notes to your legislature and tell them just briefly what it is you want, and then follow up, you all can make make the difference. It's you that make the difference. It's not Donna, it's not me, it's not David. I mean, we can help influence, but you all, it's your lives. And we need you to help step up and let people know what you want. So if you grab one of those pieces of white paper, if you have a meeting with your legislator, you may not need it. But if you don't, you can drop it off at their office today. Yes?
And so what I found, what my daughter and Vicky, and we went to the different offices and delivered letters, and we didn't actually talk to the legislators. We saw a couple and did transition, but even making a connection with the legislative aid.
Right.
Because I think that's important. Sometimes it feels like, well, how am I going to get an appointment and do all this? Well, the aides are wonderful, many of them,
Right.
and they will be a voice for you too.
Right.
So-
No, that's true. That's a really good point. They always say that, you know, legislators learn best from other legislators. They trust each other the most, then their aides, and then lobbyists, and then the bureaucracy. The bureaucracy is like the last place they go for information. So that's really good. If you can't see your legislator, see their aide because they influence their bosses. Thank you. And thank you for coming.